Okay, now we are doing thumb abduction, and first you must test the abductor pollicis longus.
All right, so the patient's going to be sitting with their forearms supinated, and the therapist is going to stabilize the metacarpals of the forefingers and make sure the wrist is in a neutral position. The patient is going to abduct the thumb in a parallel plane to the other fingers. Parallel. Oops. If they can do that without any resistance, that would be a 3. To test for a 5 or a 4, the therapist would apply resistance at the first metacarpal right below the knuckle. And if they can abduct against resistance, that would be a 5. Against a little less resistance would be a 4. If the patient can complete partial range of motion, then that would be a 2. And a 1 would be any contraction of the abductor pollicis longus, which is at the base of the first metacarpal on the radial side of the extensor pollicis brevis, so right in this area. If there's no contractile activity at all, it would be a 0. And you want to make sure that they're not using the extensor pollicis brevis to substitute. And then to test the abductor pollicis brevis, you're pretty much going to do the same test, except the patient's going to now abduct their hand perpendicular to their other fingers in an upward fashion. And, the therapist will stabilize in the same places and apply resistance in the same area. So for a 5, they would be able to complete full range of motion. For a 3, they'd be able to complete full range of motion. For a 5, they'd be able to complete the range of motion against resistance. A 4 would be against moderate resistance. For a 2 for this one, you would put the patient with their forearm in a mid position, halfway between pronation and supination. And you would ask the patient to lift their thumb up towards the ceiling. And if they can do that, then that's a 2. For a 1, you would palpate for contraction of the abductor pollicis brevis and the center of the thenar eminence, so right in this area. If there's contraction, that would be a 1, and if there's no contraction or movement at all, that would be a 0. And the substitution here would be that if they're not moving their thumb in a perpendicular manner, then they would be using the abductor pollicis longus.